Hi, I'm Debbie. I'm from Townsville. First of all, welcome this evening. Thank you. And the first question is, how will your party ensure that nurses and midwives have a strong voice in the local health and hospitals networks? And how do you envisage the operation of the local health and hospital networks from July this year?
Me first?
Yes, thank you, Adam.
In terms of having a strong voice, the Greens are very union friendly. I mean, I think we've sort of become over time the custodians of IR and unions and collective bargaining and so on. And we always put a strong focus on ensuring that the workforce always has a place at the table through their union representatives, whether that's in these new networks or any aspect of any area of health and the health workplace. I think that's probably a key way that we would see that happening. We would always protect the role of unions in the workplace. What was the second part of the question?
It was
Strong voice, and how do you envisage the operation
of the
operation of the local health networks?
I don't, I must confess, because I don't know enough about it.
Thank you, Adam.
Okay, can I just take the second point first? I think I did make comment about this earlier. I just see the networks as being a standalone clinical body to deliver the outcomes on the ground for the community. Now that would require that body also to engage with the community, to make certain that they are getting feedback and explaining where they're going to with the community, and also to lead, to interact with the lead local clinicians and the national lead clinician group as well. So they're getting advices from medically qualified people to assist them to run. As I said, the position of Brisbane would move away significantly from what it is now, because I simply don't see how I can, as a minister, if I become the minister, run Townsville Hospital. It's simply impossible. I can't run Cairns. So I want the networks to be standalone, independent, and come into Queensland Health for appropriate issues to be dealt with, and for Queensland Health in Brisbane to actually have the plan on the ground to develop statewide policies. In relation to nurses and midwives, of course Adam is right. It is a matter that the nursing fraternity across the sector would play a significant role in either the governing council, or at least in regard to the various arms that would fall from the governing council to direct what is needed for them on the ground, but also to feed the community feedback into the governing council as to what they see the issues are and how to be dealt with. So I think the issue of nurses and midwives down the track will become more and more important as time goes by. And I understand that the governing councils, if we are the elected government, will be required to deal directly with those issues on an ongoing basis, for the simple reason that they are community-based, they need community input, and nurses and midwives deliver that on a daily basis.
Thank you. That's great. Minister.
Time running?
Yep, your time to go.
Well, we passed legislation through the Parliament late last year, actually setting this up, setting up the networks and requiring under legislation that each of the governing councils establish a clinical engagement strategy as well as a consumer and community engagement strategy. So with the clinical engagement strategy, that requires the governing council to set up a structure within that network, for example, Metro North, to involve doctors, nurses and allied health professionals in providing advice, comment, information and serious input into the decisions made by the governing council. So we create a structure whereby they get a voice. But more than that, we actually create security for nurses so that their voice can be said and heard without any sense of vulnerability. How do we do that? We legislated to require that all nurses and all staff of Queensland Health remain employed by the Director General and are not employed by the network. So you can have confidence in the security of your employment, no matter which network you're working for, that you're employed with the Director General. And so you can speak up with a loud voice, confident of your security of employment. Thirdly, we want those district or those networks to re-examine the structure of decision making within the network and within each hospital. Many practical decisions are in fact made by nurses that are undervalued for the decision making that they are involved in. There needs to be a restructure of decision making within those networks to empower nurses who are the frontline workers, who know better how to make not only the clinical decisions but the management and the administrative decisions for the effective deployment of resources within that hospital and in that network. So that's one of the tasks of the new network, to take that up and put all that together, and you will have an unprecedented opportunity for nurses to not only have a say but be real decision makers within that network that we've already legislated for.
Thank you, Minister. Aidan.
Thanks for the question, Debbie. If I got $1 for every time that somebody said, "I wish we had the local health boards back," I'd be a very rich man. And I think if it did work before, it can work again. Obviously, we have our ideology for our party is it certainly comes from a decentralisation point of view. I think what we need to do is empower those local boards also to make those decisions. As we've seen, as I said earlier on, we centralise the whole process. It becomes gridlocked. So I don't see the money spent on decentralising and empowering these local boards as expenditure. I see it as an investment, because for every $1 that you empower those local boards, you save $2 from the gridlock that we're currently faced with. If I can give you an example, the Badesett maternity ward was taken out in 2001, the area that I represent. We now have 800 babies being born annually in the catchment that all go to Ipswich, Gold Coast and Logan. So they have to join the queue. Some mothers in Boone or Rathdowney have a 5-hour turnaround for a 5-minute checkup. And this is the sort of madness that you get. So now you have a frustrated patient and, of course, the burnt-out nurse at the other end as well. So what you're doing is the friction between the patient and the people in the frontline services is there before they've even met each other. And, what we've actually got to do is decentralise. I mean, we just keep building and more and attracting more and more people to Brisbane, and everyone loses out. The regions loses out, Brisbane loses out. Let's get a helicopter view and say, where can we start getting people to have smaller queues? And if that means directing some resources from one hospital to another, so be it. The disparity that we're seeing now is costing the taxpayer huge amounts, and of course delivering a rather sloppy service in terms of what the constraints are on the nurses can provide. So of course the nurses are trying to do their best, and they always end up copping the flack from a weak political system. Also, I think that any legislative change needs to be driven by those who have the direct impact of that change. They need to drive the change, not the politicians. We need to depoliticise the departments, typically the top echelons of bureaucrats, and let's start getting a proper structure back in place so that the community's empowered, the local health board can deliver, and the QNU has the necessary input to any legislative change.
Oh, good timing. Thank you, Aidan.